Hunter and I started by arriving at the surgical center, signing in with the front desk, and moving into the dressing room to put on our scrubs. After sitting in the waiting room for a few minutes, Dr. Lee's assistant came to get us and said he was ready to begin the surgery. The first surgery we witnessed was the labrum repair. The labrum is a soft, fibrous connective tissue end to the glenoid or the end of the scapula. It provides stability for the glenohumeral joint, or where the arm articulates with the scapula. A tear in the labrum results in frequent subluxations of the arm and total joint instability. Because the labrum is avascular, meaning it does not get any blood supply, it cannot repair itself, and therefore doctors must intervene to stop pain and subluxations by repairing it themselves. Dr. Lee was doing the surgery we were witnessing arthroscopically, which meant that he utilized two small portals, one for a camera and one for tools, instead of using a large incision. This allows quick recovery time and it's minimally invasive. Dr. Lee made portals on the anterior and posterior portions of the glenohumeral joint. Both portals allowed for an arthroscope to be inserted inside the joint. The joint capsule was constantly being filled with a solution that allowed Dr. Lee to adequately see what he needed to see with the arthroscope. Dr. Lee began by clearing out all of the scar tissue surrounding the labrum. This part took the longest, as Dr. Lee said his shoulder injury was very serious. Next, Dr. Lee drilled 4 bolts or anchors with 2 threads coming off the ends into the glenoid. Each time he inserted a new anchor, he would thread the threads through the labrum and pull it back to the surface of the joint and finish off by tying and trimming the thread, providing a snug and secure glenohumeral joint. Dr. Lee stated that the surgery was one of the most difficult he's done in years. He said the labrum was almost completely destroyed and he struggled to find adequate tissue to anchor back to the glenoid. The surgery took about 2.5 hours. Normally, they take about 45 minutes. Next, we witnessed a meniscus repair. Hunter Churchill will be narrating this portion of the surgery.
Like Reed was saying, our next surgery was the meniscus tear surgery. The meniscus is a fibrous pad between the femur and the tibia. It's like a pad-like structure that helps with comfort in the joint. This surgery was also arthroscopic, which, similar to the last one, there were 2 instruments in the joint cavity. One was the viewing scope and the other one was the arthroscopic instrument. Basically, they went in and looked at the meniscus to see if there was any abnormal tear or anything like that, because even the smallest tear could catch on the bone and it could create a bigger tear, which would cause further discomfort. The doctor would go in with one of the tools and slowly snip away at the meniscus pad. He would try and keep the same curvature as the natural curve, because if it was an abnormal curve, then there would most likely be snagging, which would result in a failed surgery. The next part of my project is the things that we noticed. One of the major things that we noticed was how advanced the technology was. There was the little cameras, and it could also take pictures along with the live feed. So he would go in and take before and after pictures to show the damage and what was healed with it. Another part that we noticed was with how they held up the arm. They put almost this little like sleeve on the person's arm and wrapped it up, and this would go onto a hook which would keep his arm up and allow the doctor to be able to move it at will. Along with this, you can also see the amount of plastic sheets that were used in the surgery that are put over the person, and this is not only to keep them clean because there's a lot of blood and water and other fluids that are flowing out of the joint capsule, but it's also for sterilization and to keep everything clean. We had to view the surgery in the actual room, and we would stand back, and we were actually told to stay away from the blue tables, which had all the sterilized tools. And it was kind of interesting because everything was so clean and in a neat order, but you have to be. There was also the tools that they would have to unwrap each time. These were special sterilized tools. And for our last surgery, the meniscus, they actually put the leg in a tourniquet, which would cut off the blood flow, and then they wrapped the lower part of his leg, which would constrict the blood flow, but the blood flow in the lower part of the leg too, and this would cause for minimal bleeding in the leg when they opened up the entrance for the arthroscopic scope.